Hi there, everyone. It's us again, and welcome back to episode 9 of our antenatal education series. Today we are going to be talking all things home birth. So if home birth is something that you are considering, then this episode is for you. Just going to get into our screen so I can tell you what we're doing. So today we're going to be talking about why you might like to think about or consider having your baby at home. Is home an appropriate place for you to be having your baby? Is it a safe option for you? We're going to be talking about risk assessment and the role of the consultant midwife in that risk assessment. We'll talk about the home birth teams in Southampton and how you might access them. We'll also give you a little list of stuff that you might need if you decide to have your baby at home. We'll talk about pain relief and what's available in your home environment. We'll talk about suturing, so that's having stitches after you've had your baby. That can be done at home, and we'll talk about that. We'll also talk about the statistics for transferring into the hospital from home and the reasons that that might happen. And then the last and not least, we'll talk around some of the more COVID-19 specific guidance around having babies at home and that type of thing. Okay, so moving on to why have your baby at home. So we have just literally in the last month had new evidence of all of these things, all of these statistics as to why it might be good to consider home. So as you can see, if you have your baby at home, you are 40% less likely to have a caesarean section than if you gave birth in the hospital. You are 50% less likely to have an assisted birth. You are 70% less likely to have an epidural. 55% less likely to have an episiotomy. 40% less likely to have a third or a fourth degree tear. So they are a couple of the bigger tears that we talked about in our earlier series. You are 60% less likely to have augmentation of labour with the oxytocin drip. So this is for all low risk women compared with those who were intending to be at home and those who are intending to birth in the hospital. And we've put the link and the evidence here for you to have a little look at yourself, because this is brand new evidence. This was only published last month in the Lancet. So have a little look. It makes for interesting reading. That last piece of evidence, this last piece of evidence is actually the second part of this first piece of evidence that looked at the safety for baby at home. And if you look at the birth places study, what that suggests is that if you're having your first baby at home, that there is a slightly higher risk to baby than if you were in the hospital. But actually, this systematic review referenced at the bottom of the page here just says that after a systematic review of many births at home, they haven't seen any difference in having a baby at home or having a baby in the hospital. So that's really good news for our evidence, and it can really put our minds at rest and rest assured that actually the difference of baby needing any help at birth is not any different at home or in the hospital. So home birth criteria. So, you know, is home appropriate for you? So if you're considering birthing at home, what we like to say is that you should be low risk from a medical history point of view. So have no underlying health concerns. The ones that we can think of off the top of our heads, maybe diabetes or high blood pressure or any problems with your heart. There are obviously other medical health problems that may apply. But we like for your medical history to be completely low risk. And also to be low risk obstetrically. So if you have had a baby before, for all of your pregnancies before to have been low risk and without any significant complication. Or that if this is your first baby, that your pregnancy has been low risk and you haven't needed lots of input from the doctors. And we also say that to be a singleton pregnancy, so to be only carrying one baby as opposed to having a multiple birth. Okay, I'm going to hand over to Laura now to talk about risk assessment. No, I'm not, that's me. I'm going to talk about risk assessment. So the risk assessment process is carried out at about 36 weeks with your midwife at home. So it's really important that this risk assessment is carried out at home, because the midwife can then see where you're planning to birth and see the facilities that you have and bits and pieces that you might need. Doing that in the home is much easier than being in a midwife's clinic. So she will review with you your past medical history and your past obstetric history, and she'll talk to you about the evidence and the reasons why you might be appropriate to have baby at home, or why we might suggest you coming into the hospital. Now, some women who have got a high risk medical or obstetric history may decide that they want to have their baby at home. And what I really want to emphasize here is that in the maternity service, we don't dictate to you your plan. We don't demand that you come to the hospital. We don't allow you to do anything. What's important to understand is that we give you the information based on evidence, based on the science, and you make an informed decision about the kind of care that you want and your place of birth. And if that is the case, that you wouldn't be necessarily recommended to have a home birth, but you want to be at home, what we would do would be to refer you to our consultant midwife. And the consultant midwife would make a plan, an individualised, specialised plan with you, so that your birth wishes can be fulfilled, but in a safe way. So it might be that 2 midwives would attend immediately rather than one and then the second coming later, or it might be that there are specific plans around transfer, or it could be anything. But it's really about you having those discussions, having all the information, and then making those decisions for yourself. So we also need to know about access to your property. You know, is it easy to get to? Is there street lighting? Is there parking? Could an ambulance get to your front door if it needed to? That type of thing. So we document that in your risk assessment too. If you're choosing to use a birth pool at home, we would then look at the room that you would be having your birth pool. So it's important that, you know, you're not doing that upstairs, because if it flooded, it could come through the ceiling and flood downstairs. It has to be on a hard surface downstairs, and that you've got the appropriate equipment if you're using a pool. So a hose that can be attached to a mixer tap, so we can keep the temperature of the pool between 36.5 and 37.5 degrees. So it's just a few practical things around the birth pool. We then will discuss transfer if needed, the reasons why you might need to transfer times from where you live, and that type of thing, which I think we're going to go on to talk about later. And we'll also be looking at pets, whether you have any big dogs or cats or spiders or any kind of pets that might need to be kept out of the way when the midwives are coming to the house. So the risk assessment is a general overview of how we keep you safe at home and how we keep your baby safe at home. And we do that with you in partnership. And then that's documented and kept on our system at the hospital. So whichever midwife comes out to you, she can access your risk assessment. She knows exactly where you are and how to get there, and your specialised plan if you have one, so that she can look after you appropriately. So I'm just going to hand over to Laura now.
Hi everyone. So I'm going to talk a bit about so the home birth teams. We don't have one set team in from the Princess Anne that covers home birth. We've sort of got 2 different teams. So we have Southampton City, which we cover, and the Hampshire and the New Forest area. So I'll talk a bit about the Southampton City area first. So if you live in places like Millbrook or Bitton or Southampton City Centre, your care, if you are choosing to have a home birth, will be covered by our Nest team. So These teams will caseload you throughout your pregnancy, see you for all of your appointments, and have that risk assessment with you at 36 weeks. And they would be the person, when you go into labour, you would call the contact number that they will provide you with, and they will be the first midwife on call for your home birth. And they would attend first, and do the initial assessment. And then if they think that, in fact, yep, it does look like you're in established labour, they then call for the second midwife. And that second midwife will be staffed by either one of our midwifery-led pathway midwives, who may be working on Broadlands or New Forest Birth Centre, or it may be the on-call home birth midwife. So of the new current situation that we find ourselves in, we have a dedicated on-call shift each night, which is a midwife that's specifically for home births. So it could be that midwife as well if we've got her on call. Whereas if you live in the Hampshire or New Forest area, so by that I mean the southern parishes, Totton, Lymington, Hythe, Lyndhurst, those sort of areas, you will be caseloaded by a named midwife in your area in those teams. And then when it comes to the time of labour, unfortunately, a midwife from that team sort of won't on call you, but what will happen is you'll phone the labour line, and then labour line communicate with us on Broadlands or the New Forest Birth Centre to send a midwife from either of those two areas out to you to come and assess you at home. And then the second midwife would be a nest midwife who would call, and they would come and support the first community midwife at home. So that's a bit about who you may find coming to support you at home. So hopefully that's helpful. Now, what do you need at home? This is a widely asked question, and obviously a really, really important one. So the main things that you're going to need, we've got a few listed here. So your birth plan, of course, number one. So the midwife, when they come, they can have a flick through your notes, have a look at your plan, and make sure that we're meeting your plan as far as we can. And your maternity notes, so we can just look at the history of the pregnancy and make sure that everything is sort of, as Amy said, nice and low risk, no complications. You're going to need your phone numbers for your midwifery team and labour line. So as I said, if you're in a nest team of midwives, you need that number saved on your phone. And I would also encourage women to save the labour line number on your phone, which is found in the front of your blue notes, just because it's much easier when the time of labour comes to just click labour line speed dial on your phone you're in pain. So save those numbers on your phone, really, really important. Now, some more practical things that you're going to need for actually the labouring and birth part are plastic sheeting to protect your floor, sofas, beds, because obviously labour can be a bit wet and a little bit messy. Obviously, when your waters break, once you've given birth to baby, when you have a little bit of bleeding, and obviously we want to protect your things at home. So please make sure either you've got some shower curtains, tarpaulin, whatever you want to use, got some of that ready at home before you go into labour. We also want you to create like a nice little nest area, somewhere where you feel really safe and cozy and comfortable, but which also encourages you to be nice and upright and open and forward. So think about things that you could have in your home to promote that. So things that I've seen women use are big bean bags, and then they cover that with plastic and put lots of cushions and things around her, so you can, you know, lean forwards and use it to get in that really good kneeling position. Also things such as towels. Now, I would highly recommend having a number of towels, small and large, for you and baby. So we want one or two for you, and then I normally say at least 4 or so for baby, because babies, when they come out, they're nice and wet, and we like to dry them off quite quickly and make sure that we can help them to maintain their temperature when they're earthside. So plenty of towels on hand. Also, we would be really grateful if you've got bin bags and things on hand for any rubbish and laundry that you need to pop away and put to the side, rather than it hanging around and potentially causing a trip hazard. And having a bucket, because if you're sick, you're going to want something to be sick into. So having a bucket or an old washing out bowl, something like that, that you can just bin afterwards, is ideal, or an old pot and pan. Comfy clothing, so things that you are going to feel nice and relaxed in. So if you want to be naked, that is absolutely fine. But if you would be more comfortable in a button-down nightdress or just a loose baggy t-shirt that belongs to your other half, that is fantastic. And because, you know, there may be a chance that we need to transfer you to the hospital if we see, hear or smell anything that we're not so happy with. So make sure that you've got something to wear if you were need to have to get into an ambulance, so you feel nice and modest when you get in there. And big pants, we've talked about big pants, so make sure you've got big pants on hand and a pad. And of course, the most important thing on this list, tea and biscuits for the midwives. Because obviously we could be with you for a number of hours. We do bring our own bags with our lunch in, but you know, we're always partial to a biscuit or 5. Or a whole pack if it's me. So yeah, having some biscuits on hand just to keep our sugar levels up as well as yours, because we're all in this together in the time of labour. And your packed hospital bag, just in case we need to go to the labour ward in Princess Anne. So please pack your hospital bag as normal and as we discussed back in one of our early videos, just in case we need to make that move. So those are all the sort of main things that you need. I also say it's really, really handy if you can have a mirror and a torch on hand, because when you're in labour and giving birth, you're going to be getting yourselves into really good upright, forward and open positions. And sometimes we can't quite see what we need to see and end up crooking our necks like this and that. So it's really, really good to have a mirror on hand so we can use that to help us see what's going on. And a torch, because if the room's really dimly lit, as midwives, we still need to be seeing what's going on down below to make sure everything's progressing nice and normally, especially when it comes to the time of pushing. So having a little torch on hand for us is really, really helpful as well. So let's talk a bit about pain relief at home then. So in our video on, here's an extra slide. Scrap that, I won't talk about pain relief just yet. Let's talk about what we will bring, because obviously we're going to bring a lot of stuff. We don't just rock up with nothing. So when we come in to your home, we're going to have all of these things that you can see on the slide. So let's talk through what you can see. So on the left hand side, you can see one of our lovely midwives with our home birth bag on. So in this bag, we have got everything we need for a home birth. So we've got birth packs, suturing packs, gloves, clinical waste bags, all of the instruments that we may need if we need to do any suturing. So that's what's in that big bag. And then in the little red bag that's next to it in the picture on the right hand side, we've got the neonatal resuscitation equipment. So if your baby was born and needed a little bit of help with breathing, as we would do in the hospital or New Forest or Broadlands, we put them on a resuscitation. What we do is we bring this little bag out, which has got a little bag and mask, which we can use to help inflate babies' lungs if they do need a bit of help at home. So we set up a little area when we arrive with towels and all the equipment out ready, just in case your baby needs a bit of help after they've been born. We've also, you can see that little silver coloured box in that same picture. Now in that box is all the patients we potentially need. So we've got things such as oxytocin, so if you choose to have an active 3rd stage, we've got that in there. If you were to have slightly heavier bleeding, we have got other drugs in that box as well, which can help to stem that bleeding. We've got diclofenac, which Heather will talk to you about in a little while. We've got vitamin K for baby if you decide to do that. So that's our drug box. And then you can see we bring along our scales so we can weigh your baby. Obviously everyone loves to know how much their baby weighs, and it's really important for us to know. So we bring scales, and then we've got our Entonox canisters. So that's the bottom left. I like to take 2 out with me because we never know how much we're going to get through, because some labours are really, really quick. Some other labours may take a few hours. So I always like to bring a couple with me with the mouthpiece. So if you choose to use the gas and air at home, you can do so. So that's the sort of things we will bring. Now, it's really important that, or really helpful that if when we turn up at your home, if your birth partner can come out and help us with all of this equipment. Because if, for example, I was coming out to you as the first midwife attending, quite a few things for me to carry in if I need to if I'm thinking baby's coming out quite quickly. So if birth partner can be ready at the door, I'll give you a little call and then they can come and grab some bits off me. Now we can talk about pain relief at home, I think.
The other thing that we have, in addition to all of the stuff that Laura's just spoken about, is a big plastic box. So as she said earlier, inside the red bag, we have the clinical waste bags, which all of the clinical waste goes into. And for safe transport back to the hospital, we then put that all into a big plastic box. So we'll have an extra box as well as the rest of the stuff there. So it's quite a lot of equipment we're carrying around in the community.
So pain relief. Hopefully all of you have watched our, was it our second stage of labour when we talked about pain relief, or first stage of labour. So this is the stuff, or these are the options that you have when you're at home. So obviously mobilising, I keep going on about UFO, upright, forward and open, and the importance of, you know, keeping your pelvis as wide as you can to help the descent of baby through your birth canal, and the use of gravity. We've got pools. So at home you can actually rent birthing pools. Now we'd highly advise that you're not buying any that are second hand, because we know that the companies that rent them, they do thoroughly clean them before they rent them out to the next person. So you can do a little bit of research online about where you can rent those from if you would like to use a birth pool at home. Bath, so for those of you that have got a bath at home, really relaxing, especially in the first stage or the early first stage of labour, in the latent phase, just to help you cope with that pain. Massage and aromatherapy, so birth partners or midwives be more than happy to help with a massage, but it is a nice thing for birth partners to get involved in, and a really good form of pain relief to help you relax. Paracetamol, we don't bring paracetamol with us, so you must make sure that you've stocked up on it before labour ensues. So pop yourself down to the shop and get a couple of boxes and take it as advised on the box. We've then got dihydrocodeine and Oromorph, so we don't bring those out to you at home, but what it is possible to do is, if you are planning to have a home birth, but you're in the early stages of labour and it's a bit of a lengthy one, and you think, I just need a bit of pain relief to tie me over so I can crack on at home afterwards, you can ring the labour line and explain what's going on, and then say, you know, could I please come into Broadlands Birth Centre just for a midwife to assess me, see where I'm at, and to have some dihydrocodeine or Oromorph, and then you can get yourself off back home again. And then when the time comes that you think things have really ramped up and are cracking on, the midwives will then be able to attend you at home. So that's a really good option as well for those of you who are planning a home birth but need a little bit extra. And then we've got the fantastic Entonox, so gas and air, which a lot of women use in labour. So this is the inhalation of nitrous oxide and oxygen, really good, because you control it. You breathe it in from the start of your contraction to the end. If you don't like it, you don't have to use it, but it is sort of one of the only options that we can bring with us as midwives to provide you in labour. And then hypnotherapy methods. So I highly recommend women to do hypnotherapy and hypnobirthing, because I think you know, women have had really positive outcomes with it. So have a little look online. There's some really great hypnobirthing companies out there who have fantastic websites, fantastic Instagram accounts to teach you methods and ways of hypnobirthing in labour to help keep you nice and calm and in control. Because you'll be amazed at how much breathing can actually do in labour. Just, you know, breathing correctly and really helps women to manage and cope with their pain. So those are all the options that you have available to you at home. And as Heather will talk about when she talks about transfer, if at any point when you're at a home birth you want more pain relief, all you have to do is ask, and we'll discuss with you what you want and when you want it, and we'll try and meet your needs, because this is your birth experience. And if you think, I can't continue at home anymore, I need something more, then we'll be there by your side, advocating your wishes and getting you into the labour ward. So we'll hand over to Heather now, who's going to talk a bit about suturing and transfer and things like that.
Thank you, Laura. Yeah, lovely. So as we've said in videos before, after you've given birth, we want to examine your perineum and your vagina just to see if, as baby has been born, there has been any tears or any grazes, so that if it's suitable, we can suture that for you or stitch that for you. So that's exactly the same thing that we would do at home. And as Amy and Laura have both said, when we're talking about assessing your home for a home birth, this is something else that we'd also like you to consider. Where is a suitable place for us to do this assessment of your perineum? We need to make sure that you are able to be in a recumbent position, so sort of lying backwards, and that your knees and feet are elevated so that we can open up and assess your vulva, assess your vagina and your perineum. So usually that will mean having sort of, if you're lying on the floor or if you're in bed, if you're on the floor, some stacks of books so that your feet are just elevated slightly. Or even, as Amy suggested when we were chatting about this before, what she does is, if you're on the bed, have some bedside tables or some coffee tables at the end of the bed so you can shuffle down, you can put your feet there, and then we can position ourselves between them so that we can have a really good look. Because it's really important for us to be able to identify exactly what has happened, exactly what we're looking at, and if it's suitable for us to suture at home, or if you need to transfer in, which we'll talk a bit about in the next slide. We need to have a sterile field. So that means that when there is a cut or a graze, we don't want to introduce any possibility of infection. So our suturing kits are sterile, the equipment that we are using is sterile, and our gowns and our gloves and everything that we're using, that's also sterile as well. So again, when Amy was talking about pets, this is still not an appropriate time for your gorgeous dogs to come in. As lovely, as much as I love dogs, I don't need them to help me assist suturing. So we do need to make sure that we've got a proper arena for us to be able to assess and actually carry out the suturing, and that during that time that we're able to keep that sterile to reduce the risk of any infection. Lighting is another really important one. We've mentioned about having torches at home. We don't always have a great torch with us, and of course when you're birthing at home you might like to have low lighting, you might like to have nice sort of warm nesty atmospheric lighting, but this is certainly one thing that we need a very clear light for. If you're happy to have the light on, that's fine, but we do need a directed light there. So torches, brilliant. If you can get those in and make sure you've got batteries, fantastic. Or even if you've got quite a strong freestanding lamp that's big enough for us to be able to use, that would be brilliant as well. We are not stingy when it comes to local anaesthetic. So as you can imagine, although that you'll have a little bit of numbness anyway from baby being born vaginally, we want to make sure that it is numb enough for us to be able to do the suturing. So we carry that with us as part of our drugs, and once we've assessed you, we will administer the local anaesthetic directly to the area, okay, and then we'll just test it, make sure that you're comfortable, and that's all fine. So don't worry that just because you're at home that you won't get that pain relief. You will. All of this can be happening whilst you have got your baby in skin to skin. So whilst you're having that golden hour of baby all cuddled up with you, starting feeding, we can be doing those things for you. The other part of pain relief here as well is diclofenac. So this is a suppository, so something that is inserted into your rectum. It's a double dose of ibuprofen. So ibuprofen, anti-inflammatory, it will directly affect the area where you're having the pain. You might know it as Voltarol, but diclofenac is what the drug is. So we bring all these things with us, we assess you, and that's what we will try to do at home for you, okay? So if we move on to talking about transfers, now I'm just going to skip ahead just on this bit for reasons for transfer, just to tie in with the last slide we were looking at. If we assess you and we think that that tear is not something that can be safely or appropriately sutured at home, that's one of the reasons that we would transfer in, okay? So we would make sure that your bleeding was controlled and we would call for an ambulance to help get you into hospital. But that is one of the reasons for transfer. Now, realistically, when we're looking at the statistics below, you might look at that and think, oh my goodness, I haven't had a baby before, and 45% of people in my position need to transfer in to the hospital, to the labour ward. But if you just cast your eyes on the statistics below that, if you were in Broadlands or if you're at the Forest, you've got 36% transfer from the freestanding, which in Southampton is the Forest, and 40% from an alongside, which is Broadlands. So those statistics are quite close. So don't worry too much thinking, right, well, I need to give birth on Broadlands because just in case something happens and I need to transfer in. It's quite close in the likelihood of transferring in if you were still suitable to be birthing at home. And a little bit further down that, you can see that those rates drop dramatically if you've had a baby before. So you've got 12% transfer from home, 9% from the freestanding unit, or 13% from the alongside unit as well. So that's if you are having a second baby. And like Amy and Laura have said, we look at your medical and your obstetric history to see if a home birth is suitable for you. And if it is, and you've had no problems in your previous pregnancy or birth, there's no reason there, unless you choose not to have a home birth for that. So just skipping back up to the top. So reasons that we would transfer. So bleeding. Everybody loses a little bit of blood after they have given birth because the placenta comes away. There's a site of blood that would need to stop after your uterus is contracting. We have a limit on what is an appropriate amount of bleeding, and if we think that that is starting to exceed that, not only will we administer the drugs in your leg to help stop that, like Laura said about the drugs that we carry with us, but we will call for the paramedics for us to transfer in, because we don't want you to lose too much blood, because blood is important and we don't like you to be too generous with it after you've had a baby. If there is a deviation from the normal or expected progress in labour, so if your cervix isn't expanding as well as we would hope it would, it's a very slow process. Don't forget that your contractions, they're not only making you tired, but they're having an effect on baby as well. And if there's no progress, if the outlet for the baby is not getting bigger, so that we're moving closer to actually birthing this baby, there's a risk that baby could get a little bit tired. But that is something that we monitor, and the same as if you were in a unit, we would examine you every 4 hours unless it was medically appropriate to do it a bit sooner than that. If we've got concerns about baby's heart rate, so if they're tachycardic, so if their heart rate's going quite fast, we would want that to settle. Or if it is dipping too much, either with your contractions or just after your contractions, which, remember when we were talking about second stage, we listen every 15 minutes or every 5 minutes, depending if you're contracting or if you are pushing, and we listen after a contraction because we want to make sure that they are coping with the pressure that's being put on them. If you have high blood pressure, so we will look at what your blood pressure has been through pregnancy. If this is starting to increase either to an unusual level for you, or even just a clinical unusual level, that's another reason that we would want to transfer in as well, because there are conditions that are associated with high blood pressure which can cause risks for you and for baby. When we talked about third stage, which was the placenta, we talked about saying that we want that placenta really to be expelled within the hour. If it hasn't come out within the hour, it is classified as a retained placenta. Now, there might be a reason why that placenta isn't coming away, and we don't want to put any undue pressure, especially when you're not at home, just referring back to the top reason there for bleeding. So if the physiological stage hasn't worked and we've had a delayed active stage and that hasn't worked either, we would really, really like to transfer into hospital, because retained placentas, they have to be helped out in theatre, because we need to make sure that you've got enough pain relief, and when that placenta comes away, that the uterus is able to contract well enough behind it. I've already mentioned about being unable to suture at home, but also if baby is born and they require observations. So we've talked about meconium, so if baby has a poo inside, or if they come out and they are quite, they're clinically unwell. So if their breathing rate is too quick or too slow, heart rate, temperature, we can't have somebody at home for the next 24 hours with you doing that baby's observations. So we would need to make sure that baby and you come in so that you can be observed, so that we can make sure that that resolves itself, or that we're intervening to help baby out as well. And of course, like Laura said, if you want extra pain relief and you're at home, you absolutely can ask for it. You might be well, baby might be well, but you might think, do you know what? I've tried all the options of pain relief I've got at home. it's not quite enough for what I need. No reason that you can't transfer in to labour wards so that we can get you some remifentanil, which is the one that goes in the back of your hand, or that we can get you an epidural. Okay, so just because you're birthing at home, don't think that you've written off your opportunity to have that stronger pain relief if that's what you need. Especially if it's your first baby, you haven't laboured before, you don't know how it's going to feel, so don't feel that you've had a failed home birth or that you've done something wrong or that it's just taking too long. Please just let us know as we're going along so that we can facilitate what you're asking for as soon as we possibly can. Okay.
Having said that, I just wanted to add, if that's okay, Heather, that actually one of the reasons that women would like to stay at home is because they're in a familiar environment where they feel more in control of their birth experience. So, when we're talking about the need for pain relief, of course, if you're a first-time mum and you've not done this before, you don't know how it's going to feel. But just being in an environment that is more familiar to you, with the things around you that are familiar, the ability to walk around your own garden, use your own path, and do what you want to do on your territory, if you like, that is known to reduce the need for needing more pain relief. So that's one of the considerations to think about when thinking about home, actually.
Absolutely. And as Amy had in her first slide about the statistics for women, having this home birth is likely to reduce your need to have it. So yeah, absolutely, definitely. Thank you.
Pleasure. Okay,
so this one is slightly topical. So if you are watching this in 2035 and we've finally been allowed out of our houses again, this might not be as applicable. We might edit it, I don't know. Maybe robots will be doing it by the time this all happens. Anyway, so home birth during COVID-19. Now, a number of women that I care for, and I'm sure that Laura has the same, are asking more about home birth because they don't want to come into a hospital environment with the risks of contracting a virus. Completely valid questions, completely valid concerns, and we do our best to answer them as and when. Now, if you are birthing in a unit, so if you're birthing in hospital, you may have seen on our Southampton maternity service page quite rapid changes in terms of birth partners having to have their temperatures tested every 4 hours, to birth partners not being allowed to go to the postnatal ward. And then Tuesday, just gone, or last Tuesday when you were watching this, whenever it was, it changed so that we screen both you and your birth partner for COVID-19. And once they have had a negative result, they can absolutely come to the postnatal environment with you. Now, of course, if you're at home, your postnatal environment is at home. We're not going to say, sorry, you can't stay at home because you've got a positive result. But we will still want to test your birth partner's temperature every 4 hours and on arrival as well. So in March alone, we saw a rise of home births. I think it was 15 home births that we saw. Amy, do you know how many home births there were in April?
There were 16 home births in April.
And how many do we normally have, ish?
Usually between 3 and 8.
3 and 8. So it's quite a jump. So it's kind of making us feel like women are starting to believe what we say when we say, well, if you'd like a home birth, you're absolutely, it's super suitable for you. But this is the thing about trusting in your body as well. So if you are thinking home birth, whether it's for coronavirus or whether it's because that's what you want, please consider it. When you're first pregnant and the triage midwives speak to you, they might say, have you considered a home birth? Might not have even crossed your mind. It doesn't mean that we won't revisit that when we talk to you in your antenatal appointments and do your risk assessments and things at 36 weeks. So when you are at home, you may have other children there, you might have other family members who live with you, and that's absolutely fine, but they need to be in another area of the house because
we've lost the sound.
We've lost Heather.
We still at the moment need to observe social distancing.
Heather, we lost you there.
Oh gosh, okay. Where did I go from?
So other members of the house needing to be in a different room.
Okay, sorry. It has been a bit glitchy, this video. Sorry about that. Yes, so if other family members live in your house, that's fine. If you have other children that are at home with you as well, again, that's fine. But we would ask that we do not come into contact with them unless completely unavoidable. And that's one of the things that you have to think about when you're assessing your own home as to whether it's suitable for a home birth. If you think, well, I was going to have a home birth because I don't have somebody to look after my children, you also have to think, well, what would have happened if you birthed in hospital? Who'd be looking, or if you need to transfer in, who is going to look after your children? So think about those things as well. Try to use the largest room in your home for the majority of your labour care. Obviously, you might want to, like Amy said, go out to the garden, use your bathroom for a shower or a bath. But when we're in an environment with your birth partner, again, social distancing is what we're trying to observe. The room needs to be well ventilated. Obviously, we know COVID-19 is a respiratory disease, and that's where it's affecting. So we need to make sure that there's good ventilation, that we're not all in the same room just breathing the same old air. And we need to have easy access to hand washing facilities and a clean towel for hand washing. So make sure that you, when you're getting your things together, your towels, all of those things, that you are setting aside a towel so that we as the providers can use that ourselves, or even paper towels, so that we can just dispose of those straight away. Do a bit of a wipe down. Okay, so whether you do that with antibacterial wipes, or you have a cap full of bleach, put it in your litre of water and you spray it all down, we're trying to reduce the risks of spread. Okay, so it's not just about us keeping you safe when we come to your home, we need to keep ourselves safe as well. Okay, so we're looking at door handles, light switches. If like me, you kind of push doors closed by the panel of the door, wipe all of those frequently touched surfaces down, kitchen tops, the kettle, all of those things. If you touch it during the days before you go into labour, think, right, that's the thing I need to wipe down. And finally on this slide, we will turn up in our personal protective equipment, in our PPE. So when we are attending births in a unit, at home, whether we're at the forest or on labour ward, we are wearing our aprons, we are wearing gloves, we are wearing masks, and we are wearing eye protection as well, whether that's a visor or goggles over our glasses as well. When we turn up, we will turn up wearing it, okay? We haven't driven in the car with it, but we will turn up, we will put it on, and then we will come in. We will use that whilst we are looking after you, and then before we go, we will have a double bag at the front door. And by the time we get to the front door, what we'll do is we'll take all of those things off at the front door. We will dispose of those, tie those up, and put them in the big plastic box that we are taking away with us, that also contain anything that's had any bodily fluids on it, so that we can make sure it's disposed of properly in the hospital. So this whole slide is about reducing risk. Okay, so reducing the risk of you being infected, reducing the risk of us being infected, and just zero risk, being totally as safe as we possibly can. But if you've got any concerns, then please, please, please ask your midwife, or if you've got any additional questions on these particular guidelines, which may change over the next few days, whether they're loosened or whether they're lengthened, then please pop your comments in the comments below. So please let us know. But that is all on that one. So I will hand back to Amy.
I just want to go back to testing, because I just want to make it really clear that we're not currently testing women or birth partners for COVID-19 at the New Forest Birth Centre or at home. We're not currently doing that. That may well change. But at the moment, what we're doing is just observations and temperatures at home and symptom identification. That's all we're doing. We're not actually doing the testing unless you come into the hospital. Just wanted to make that clear. All right.
Perfect. Thank you.
So that is a little whistle-stop tour of home birth and all things home birth. We get a little bit excited about this. It's generally what us midwifery-led pathway midwives get excited about. So if you've got any questions or any queries, any worries at all, then like we've said before, write your questions in the thread below, or speak to your midwives or consultant midwife if that's applicable to you. So on Friday, we are going to be releasing the postnatal care video. So we'll be talking about all things after you've had your baby, including screening and weighing and postnatal visits. So that's on Friday. You want to add anything else, guys?
No, I think that's everything.
Oh, the other thing I'm going to release next week is a quiz. So we are going to do a labour and birth quiz for you. And we're going to release that next week on the Broadlands page. And then when I do my Facebook live session, I will go through those answers with you. And it's really just to go through everything that we've talked about in every single video, or not everything, but most things, just to see if we've retained that information and see whether we've covered everything that you need and answered any questions that you had. All right. So we look forward to seeing you then. Take care.
Bye.